a dear friend of mine as well as somebody that has changed my life. We're going to be talking about a not so fun topic, trauma, PTSD, and how we deal with that. But most importantly, we have several messages we want to convey, and one message that I want to convey to all of you is that you don't have to, all of us suffer from trauma, right? And it's okay. And sometimes you think, oh no, I'm just a stressed woman, I'm in a male-dominated field, it's a stressful job, I have a family or children. All that can accumulate to trauma that can affect us, and it's up to us to take care of ourselves and be honest with ourselves and seek that help and help one another. So, Dr. LaBeouf, would you mind introducing yourself and we'll get started?
Well, thank you very much for having me. I'm a physician, so I'm an anesthesiologist. Typically, people like to do them, get stroke for people like myself. So I'm also a pain physician, so I'm not a psychiatrist, so I don't be a psychiatrist. And I'll get the reasons. My mother was a physician, and she got single. She was medical stroke, secondary PTSD. So my father came back, severe PTSD from World War II. He gave it to my mother and me, and I actually my mother for life. That gave me a lot of impetus to be interested in trauma and what it does to the brain, especially when considering having my mom. So it's interesting. So I was able to come up with an odd science. It's very rare to come up with your own science in medicine. But there is a procedure called cell division. It's been done since 1946. It's basically a way to numb out fight or flight nervous system. Very forward, I've been doing it for years. First time I did it was 87. So in 2006, I figured out it could work with PTSD. And since then, it's been replicated a number of military institutions, not as much as civilian institutions. It's still a weird concept for a lot of physicians. And regularly, people are used to taking pills. Right? But pills suck. Pills kill. So I'm not a fan of pills. I'll tell you that right now. I'd like to get as many people off pills as possible. So people say PTSD is invisible, which is very common in video games. So my answer to that is it's invisible if you have your own scanner. So what I mean by that is if you use a functional MRI, it's a very specific way to look how the brain works. You can actually see PTSD. You can actually, people have done a PET scanner, is another one of those PET scanners. So there was a study done with bone tissue beforehand. We did the blood. You can reverse PTSD changes in someone's brain in 2 days. And you can actually see it. So the whole concept to me is, number one, if you think of PTSD as a real condition, that will help you actually get treated. Because a lot of times, we all second guess ourselves. Women do it much more than men. That's how God built us. My wife's an amazing woman. Second guess yourself all the time. Why? It's innate, right? The other difference between men and women is that if a man and a woman has the same type of trauma, the sexual trauma, military trauma, whatever, women develop PTSD despite the rate compared to men. People don't think about it because they think it's only military guys get it. It's all contrary. It doesn't matter what the trauma is. Being bullied, being attacked, being in military action, being scared, being sexually, whatever. Nowadays, what that is. All leads to trauma. But the difference is, all of that is the same in the brain. Brain does not care about your head. I was giving a speech in Briscoe's military museum, and this older gentleman got up. He said, "Are you saying that a rape trauma is the same as my trauma? I got one of his men." I said, "Yes." Are you telling me that when a woman is tied up and raped for 10 years straight, her trauma is less than yours? Is that really where you want to go with this discussion? It wasn't true. But yes, biologically, it doesn't matter. The treatment is the same. That's what's cool from my perspective. People say, well, there's like, if you look at DSM-5-TR, which is diagnosed PTSD 6, by the way, I'm trying to change that name. PTSD